novel static computer-aided surgical and freehand techniques for osteotomy and root end resection. A cadaver study led by Federico Martino, who is an endodontist in the University of Maryland. To start, we all know the advantages of guided surgical endodontics, as it can avoid damaging critical structures such as large blood vessels, mental foramen, and maxillary sinuses, and of course improved access, and especially in cases with lack of direct visualization and complex cases. This study had 46 teeth in 2 cadavers, divided into 2 groups, 23 teeth for each group. They compared a novel technique of guided endodontics, of guided EMS, compared with freehand. The novelty of this technique was that it used sequential drills, starting from 2 millimeters and then sequentially increasing up to 7 millimeters. So they had 2 fresh cadavers, and they measured accuracy in according to 2-dimensional deviation and 3-dimensional deviation. They had multiple parameters, and also they assessed the efficiency measurements through time and number of mishaps being sinus perforation, nasal floor perforation, and nerve transection. The results: the guided group had significantly less errors, as we can see in this table. So there was a significant difference between the freehand and the guided, especially in the angular deflection. So the advantages, or the results, looking at these results, time required was significantly less in the guided group, and this avoids excessive bleeding, anesthesia loss, patient and operator fatigue, and also avoid potential technical errors. However, this guided technique has disadvantages of complex workflow, multiple time-consuming preoperative steps, and also the cost on the patient's finance and additional time for 3D model preparation on clinicians. However, in the regarding the number of mishaps, there was no significant difference between the 2 groups. Regarding the model used here, we all know that the cadaver has anatomic and tissue fidelity in comparison with the typodont surgical model, as it's similar to a live patient and anatomical structures. However, it lacks saliva, blood, and patient movement, which could account for some of the deviations. So this technique was more efficient than the freehand model. However, a clinical study is needed to further validate these results.